I love that.
Hey, one of the best things about this program in particular is that we get to interview celebrities and authors and even CEOs of public companies when you guys email us. And one of our producers, Greg Todoroff, got an email from a listener, or I guess it was a TV viewer, about a company called InspireMD. And they are publicly traded under the stock symbol NSPR. InspireMD is in the cardioid space, changing the way carotid artery disease. This is why I'm done a doctor.
That's a tough one.
But this is about strokes. This is about managing artery disease. And here to talk about it, Marvin Slosman is the CEO of the company. He's been very generous with his time here to come on the air. Marvin, how are you, sir? Good to talk to you.
I'm very well today. Thank you, guys. I appreciate the opportunity.
Yeah.
Good intro. I appreciate it.
You got some fans. Apparently, they wanted to see what you had to say. So we thought we'd bring you out there. Can you talk about what you guys do and give us a we're a couple of Johnny Lunchbuckets here, and the rest of our audience is much smarter than we are. So if you could kind of break down what you guys are all about, what you guys are doing at InspireMD.
Sure, absolutely. Thanks for the opportunity.
Sure.
So InspireMD is a growing medical device company with a highly specialized focus in stroke prevention and managing carotid artery disease. So that's an awfully big, bold statement, but as we all know, heart disease and strokes really account for the predominance of really awful medical conditions, both death and disability. And by way of our advanced platform of our stent technology called CGuard, in this really interesting, innovative design of applying mesh to the outside of our stent, we think we've created a breakthrough device that really has the opportunity to change standard of care when it comes to how carotid artery disease is managed.
And basically what you're doing is that's almost like that's a support system, is it not? Sort of, you've got a stent that sort of creates the flow, but then that sort of supports the entire biologics around it, so your vein and everything else. Talk about how that actually works for us, would you, Marvin?
Yeah. So the simplistic view of this is it is a nitinol stent, a self-expanding stent, which is pretty commonplace in vascular disease management, as you all know. But what's different about our solution is we have something called micronet mesh, which is a woven mesh outer layer about the thickness of a human hair, which is stitched to the outside, knitted and stitched to the outside of our stent technology, which prevents embolic reactions or plaque from protruding and breaking off during the stent procedure. So as many people know, atherosclerosis and artery disease grows over time. And what often happens is during the stent procedure, these particles of plaque will break off. And without an overlay or a supporting filtration system, what ends up happening is these mini strokes post-procedurally. So You're right. It's a very simplistic but sophisticated solution.
Hey, we can't do an interview with a biotech, biopharma, bio company without talking about the C word, and that's COVID. Obviously, you guys have been able to move the ball forward little by little during this crazy 2020. Can you give us a top-down look on what it's like being a biopharma, biotech company in the middle of a pandemic? I mean, you've got 35 years of medical experience. I'm sure you haven't seen anything like this. You've been with the biggest companies there are, and you've been with early stage companies as well. Give us your top-down overview of what's happening, how we're doing, and what it's like being a company in the middle of all this.
So we're certainly in unprecedented times, guys. And I think the challenge for us has been that we're in a touch business. When we're in the theater, in the cath lab with our physicians, it's where we do our best work. We take a very consultative approach. We're hands-on. We work with our physicians to do these procedures. So the challenge for us has been to sort of being locked out of that environment, and our physicians are frustrated also because obviously COVID has dominated their environments as well. The good part of this for us is that these procedures, for the most part, are elective. Most of the acute strokes that are taking place are still being managed, but many of our procedures are elective procedures. And so it's not a question of whether or not the procedure will happen, it's a question of timing. And so we have taken this opportunity to continue to move the ball forward, educate our physicians, and work with our distributor partners to try to make ourselves available as necessary. And as you know, the world is sorting itself out, but when disease states occur, they have to be addressed, and it's all being sequenced now. The majority of our business is also outside of the US, it's in Europe, And so they have been particularly hard hit early in the cycle, but are responding favorably as well. So it's been a challenge. All of my peers that are running medical device companies are all struggling with the same effort, but we're still continuing to offer solutions. And this is when real partnerships and credibility comes into play.
Sure. His name is Marvin Slosman. He's the CEO of InspireMD, one of the companies that you guys asked us to interview. And you can go to their website, InspireMD.com. They are publicly traded under the stock symbol NSPR. I got to ask you, Marvin, about the FDA. I mean, I think we're all hoping that the FDA is putting all of their resources into keeping us all healthy, but obviously they've had to put a fair amount of triage, to use your parlance, into COVID, right? Are people like you being pushed aside? Because that's a very serious disease I mean, there's got to be, they have to be able to, I mean, there's still cancer going on. There's still, there's still blood diseases going on. There's still heart disease and stroke. How are they managing, in your opinion?
Yeah, I think remarkably well, and we were actually quite fortunate that we got approval for our FDA trial during the worst part of the pandemic. In fact, we're thrilled to be able to initiate pretty soon here on an approval from the FDA our clinical trial to enter the U.S. market, and this happened, right in the middle of the COVID crisis. And I think from a regulatory perspective, they've managed remarkably well in keeping, all companies, including ours, on track and with breakthrough technologies in the pipeline. It's actually worked quite favorably for us. It's a lot of work. We initiated the effort with the FDA over a year ago, and so we're thrilled to have an approval to move forward with our clinical trial to enter the U.S. market.
Marvin, we'd love to have you come back with us and keep sharing your wisdom. I guess one last question for you. Let's get out of here. What does 2021 look like for you? I mean, can you even tell? Can you
better?
Can
I
you
just hope it's better.
It's going to be better. But can you even plan at this point?
We have. I mean, we term it the COVID drag, because we believe, again, that our customers and patients have disease states that will require intervention at some point in time.
Sure.
And so we look to 2021 to really be a focused period on our commercial growth and our outreach. We have always been a patient-focused, patient-first company, and we will continue to be there when these procedures are ready to take place, and hopefully we'll be able to grow our market share and presence.
All right, Marvin, thank you so much. Marvin Slosman, CEO, InspireMD. They are publicly traded under the stock symbol NSPR, InspireMD.com.
He's right. You put off some elective surgeries because of this. I